Okay, hi, my name is Monica. I'm one of the nurse practitioner students, and I will be doing your head to toe assessment today. I'm going to start off by just looking at your scalp. I'm going to palpate for any lumps or bumps. I don't feel any lumps or bumps. Okay, so now I'm going to assess your face. I don't see any lesions or bruises or scars. So I'm going to just palpate your temporal pulses. Okay, your temporal pulses are strong. Okay, now I'm going to ask you to make a few faces. I'm going to have you to raise your eyebrows. Close your eyes. Give me a big smile. And then frown. Okay, puff out your cheeks. Puff out your cheeks. Okay, good. All right. What am I going to do now? Oh, and then I'm going to just palpate for your masseter muscles. I'm going to ask you to open your jaw. Open mouth. Close. Open. Close. I'm just palpating or feeling for any clicks or pops. I don't feel any clicks or pops. And now I'm going to test the sensation of your face. I'm going to use this counting round, and you just close your eyes, and if you feel on your face, say now.
No. No. No.
Okay, very good. So now we're moving on. I'm going to assess your eyes. Looking at the outer structures of your eyes, everything looks symmetrical. I don't see any drainage. I'm gonna just look up. Gonna check your sclera, conjunctiva, it's pink. I don't see any drainage, no pus, everything looks normal. So now I'm gonna attest for your accommodation, convergence, and EOM. Just look at my finger. Follow my finger with your eyes without moving your head. Good. I'm checking for nystagmus and checking of the eye. Very good. Okay, so now I'm gonna just dim the light, and I'm gonna test your pupillary response. I'm gonna have you look straight. I'm gonna shine a light in your eye twice. I'm gonna check for direct response and then consensual. Look, just look back. Okay, now I'm gonna do the same thing on this side. Look straight, just straight. Don't direct pupillary response and then consensual response. Okay. Now I'm gonna test the back of your eye, or assess the back of your eye. So you just look straight ahead. Don't move your eyes. So I'm gonna just shine a light in your eye. I'm gonna just look for a red light reflex, Dixon cup, and then fovea and macula. Okay. Now I'm gonna do the same thing on this eye. Look straight. Keep eye open. Look straight. Okay, I'm looking for red light reflex, Dixon cup, and then I'm gonna go lateral, looking for fovea and macula. Okay. Very good. Do you need a minute? Are you okay? All right, next I'm going to assess your ears. Outside, they look symmetrical. I'm going to palpate for any pain. Do you have any pain? Any discomfort?
Yes.
No discomfort?
Yes.
No discomfort?
No.
Okay. Oh. Okay, so now I'm going to just do the whisper test, and you just whisper back the words that you hear.
Cat. Mouse. Dog.
Okay. Same thing on this side.
Dog. Cat. Rats.
Okay, very good. So now I'm gonna look at the inner structures of your ear. I'm gonna pull the pinna up, out, and back. Looking for the tympanic membrane. It is pearly and gray. Same thing on this side. Pinna out, back, and up. Back. Okay, looking for the tympanic membrane. It is pearly and gray. Okay, very good. So now I'm gonna assess your nose. Looking at the nostrils, I don't see any scars or lesions. There's no deviation. Now I'm gonna ask you to do the sniff test. Close one nostril and sniff. Now do the other side. I'm checking for patency. Very good. Now I'm gonna look inside. Looking at the turbinate. Looking for any polyps. I don't see any polyps. Turbinate is pink and moist. Same thing on this side. No polyps present. Turbinate is pink and moist. Very good. So now I'm gonna look at your mouth. So I'm gonna have you open your mouth. Oh, yeah. I'm gonna check your gums. No, close your mouth, close your mouth, close your mouth. Gonna check your teeth, your gums. Very good. Now open your mouth. I'm gonna look inside for assessing the buccal mucosa, the hard and soft palate, underneath the tongue. Stick out your tongue. Underneath the tongue. Up tongue. Good. And then say ah.
Ah.
Okay. Very good. Okay, moving on. Now I will be assessing your neck. I'm looking at your neck. I don't see any scars or lesions. I don't see any deviation. So I'm going to start by palpating your lymph nodes, starting with the preauricular, postauricular. I'm assessing for any nodules, occipital, then posterior cervical chain down, back up to the submandibular to submental, to the anterior cervical chain, down to the supraclavicular lymph nodes. Okay, I don't feel anything. So now I'm going to assess the trachea. Trachea is midline. Now I'm going to have you just sit a little forward. Now I'm going to palpate for the thyroid. Looking at her neck, the thyroid, I don't see any masses or goiters. Can you take a sip of water? But don't drink the water, don't swallow. Put water in your mouth, but don't swallow. A little bit is fine. Okay, so I'm gonna palpate for the Adam's apple. I feel the landmark. I go lateral out and down. Go to the right, and I'll swallow. Okay, very good. Now do it again, and we'll do to the left. Okay, same thing. I'm gonna palpate for the Adam's apple again. That ridge, go lateral out, and then I'm gonna go down and swallow. Okay, I don't feel any nodules. Okay, now you can sit back this way. I'm gonna ask you to shrug against my shoulders. Very good. Okay, resist. Okay, now I'm gonna move on to the thorax. I'm assessing the thorax. Her AP diameter is 2 to 1. That is normal. I don't see any scars or lesions. So now I'm gonna just palpate. Okay. Okay, I'm gonna do same thing on the back. Gonna palpate. Okay, I don't hear or feel anything. Okay, sit. No, I'm just gonna listen to your lungs. You could just breathe normal. Deep breath. Okay, deep breath. Okay. Deep deep breath through your mouth. Deep breath through the mouth every time. Okay. Good, lung sounds clear. Now I'm going to assess and move on to the cardiac portion, cardiovascular assessment. I'm going to palpate her carotid. Present. Present. Now I'm going to listen with the bell. Take a deep breath and hold it. Okay, the other side, you can breathe. Okay, very good. Now I'm going to have you just sit forward and breathe normal. Just lean forward, just lean forward. I'm assessing for any pulses and heaves. I don't see any. So now I'm going to listen to her heart with the bell and the diaphragm and sitting up and supine. Okay, you can sit normal. Just sit normal. Starting with the bell, listening at the atrial, pulmonic, Erb's point, tricuspid, apical. Okay. Now I'm going to listen with the diaphragm, atrial, pulmonic, Erb's point, tricuspid, apical. Okay, so now I'm going to have you lay down. You don't just lay, just like this. Just lay down. Same thing, gonna listen with the, maybe scoot forward, because they can't see you.
I'm done.
Okay, fine. You could put your arms on your side. Okay, same thing. Atrial, pulmonic, Erb's point, tricuspid, apical. I'm going to switch over to the diaphragm side. Same thing. Apical, pulmonic, Erb's, tricuspid, and apical. Okay, everything sounds good. Okay, now I'm gonna inspect your abdomen. I'm looking for any scars or lesions. I don't see any scars or lesions on the abdomen. Then I'm gonna just auscultate the 4 quadrants with the diaphragm. Listen for bowel sounds. vowel sounds are present. Then I'm gonna just put cuss all four quadrant. So now I'm gonna percuss for the liver border, percussing to see a change in timpani. Okay, so I'm gonna have you take a deep breath.
Mhm.
Take a deep breath. And exhale, exhale. Breathe out. All out, out, out. Okay. Feeling for the, palpating for the liver. Okay, it's at the hook. Now I'm going to just palpate all four quadrants. Do you feel any pain?
No.
Any pain? No. Any pain?
No.
Okay, very good. You can sit up. Okay. Now I'm going to assess your peripheral vascular. So I'm just looking at the arm, looking at the temperature and the color. Everything looks normal. I'm going to check for her capillary refills. Very good. Capillary refills. Very good. Same thing with her. Her legs. Going to check, assessing for color, warmth, temperature, and I don't see any edema here. Then I'm going to check for her capillary refill. Capillary refill is less than 2 seconds, so that is normal. Okay, I'm going to also assess for pulses. So I'm going to check for the brachial. Just relax. Okay. Radial pulses. Okay, present. Maybe I have you lay down again. Okay. Now I'm going to assess for the femoral pulses. Okay, present. Okay, now I'm going to check for the popliteal. You angle your legs at a 30-degree angle. This one. Okay, present. Then you can sit back up. I'm gonna check for her. I'm gonna check for dorsalis pedis pulses. And then the posterior tibialis pulses. Okay, and that is present. Okay, so now we're gonna assess your sensory. I'm gonna have you close your eyes. Close your eyes. If you feel the cotton round on you, just say now.
Now. Now. Now. Now.
Okay. Very good. Now I'm gonna assess for your deep tendon reflexes. So we're gonna start with this side. I'm gonna have you relax your arm. Relax your arm. I'm gonna feel right here, and then, okay. And then this side, the tricep, relax, tricep reflexes. Okay, very good. Now I'm gonna test for the brachial. Okay. You relax? Just relax. Okay. This side. Okay. Feeling for the brachial pulse. Okay. Then I'm gonna assess for the brachial radialis pulse. I'm gonna just relax. Go 2 finger breaths from the distal radial pulse, and I'm gonna relax. Just relax. Okay, 2 finger breaths. Okay. Right here, 2 finger breaths from the distal radial pulse. Right here. Okay. Good. Now I'm gonna assess your patella. I'm gonna have you do this. When I count to 3, you pull. 1, 2, 3. Okay. Same thing on this side. 1, 2, 3. Okay, very good. So now we're gonna test the Achilles. Relax. And then, oh, very good. Right here. Okay. Gonna test the Babinski reflex. Just using this side. Very good. And relax. Okay. Very good. So now I'm gonna have you stand up. I'm gonna assess your spine if you wanna just dive down like you're going down. Yep, bend down. Yep. Assessing her spine, the curvature, everything looks normal. You can sit up. Now I'm just gonna ask you to do a few movements. Put your hand on your hips, twist to the right, twist to the left, and then dip to the right, dip to the left, and that is our physical assessment. We are done.